Do breast biopsies cause breast cancer to spread? It's a great question, and it's more of a theoretical risk than an actual risk, and the information we get from an image-guided biopsy will really help guide your treatment and improve your outcomes. Hi, my name is Dr. Robin Roth, aka the Booby Docs. I'm an associate professor of radiology specializing in breast imaging, and I do image-guided biopsies all day long. So I found a literature review from the British Journal of Radiology from 2011 called Seeding of Tumor Cells Following Breast Biopsy Literature Review. There were a number of studies that looked at this, whether or not there was a significant risk of recurrence or spread. Studies show that it occurs in about 1/3 of patients, but the good news is that the seeded cells may not survive displacement, and incidence of seeding along the needle tract decreases with time. So if there's a longer length of time between the biopsy and the surgery, you have a lower likelihood of seeding. They found that actually the risk of tumor seeding was lower when you use a vacuum-assisted needle, 23% versus 37% with an automated gun needle. And that requires you to go in and out several times. In most cases, the actual biopsy site will be removed when they take a patient to surgery for breast cancer, and any residual microscopic cells will be killed by radiation and chemotherapy. People were asking, could they take a patient directly to surgery? And most surgeons will want to know exactly what type of breast cancer they're treating before they take a patient to surgery, because breast cancer treatment can vary significantly based on the type of breast cancer, receptors, the size. Also, unless you're being treated with mastectomy, most surgeons will need radiology to perform some kind of localization procedure where we place a needle or wire into the actual breast tumor so we can help the surgeon take out the area that needs to be removed. So placing a needle into a breast cancer is kind of unavoidable. Doing an image-guided procedure before breast cancer surgery will really allow your breast cancer team to have more information so they can treat your breast cancer appropriately the first time around. I hope that was helpful. As always, follow the Booby Docs for more of the breast information.